Thanks for joining us. With the kids heading back to school, the Minnesota Department of Health is reminding parents about the dangers of spreading disease.
CTN's Joe Nelson shares how new laws going into effect on Monday mean longer trips to the doctor for families across the state.
Vaccination is really our first line of defense, and so the more kids we can get vaccinated, the better.
Spencer Sears and his brother Hunter made a trip to the doctor Thursday. It was no emergency, but it wasn't just a normal checkup.
It's like a school requirement, I think.
He thought right. The incoming 7th grader at St. Francis Middle School is one of thousands who must get vaccinations before classes begin, and this year is different. Minnesota law now requires 11 to 12-year-olds to be immunized for meningitis and pertussis or whooping cough as part of their regular tetanus shot.
Recently around the country there's been outbreaks of pertussis in people who are unimmunized, of course. But even in those who've been immunized, getting pertussis, because that immunity that they got way back when they were kids, those immunizations, that protection has waned over the years.
Ian McCleskey, a father of 4 with kids at Mississippi Elementary in Coon Rapids, says he's not opposed to his kids getting shots to avoid serious diseases.
I can see it being required as a precaution because it was such a big ticket issue last year, especially meningitis and I think whooping cough.
If we don't get them and we get sick, it might become like a big deal, and you might have to go to like the hospital and get like other shots, or maybe even need like surgery to do something. So it's better just to get the shot over with than not have it at all.
There's a couple ways to look at it. There's from the individual child. You don't want your own child to get these illnesses. And then there's also the public health. Can we keep our community healthy?
Now, there are exceptions to the law. Parents can get medical exemptions or can object to the requirement, but they have to fill out the paperwork to do that. Steve and Karen.
Important information. Thank you.
Hopefully they'll be healthier because of that.
The public health too.
Thank you.
Thank you.
Joe.